Legg of Perthes disease. Hip disease of unknown etiology. Usually it affects the boys 4 to 8 years old, and it is 4 to 5 times more common than girls in boys. 90% cases it is an unilateral disease, and 10% it is bilateral. The basics of the disease is the vascular supply of the hip joint is impaired by infection, trauma, or by unknown reason. There is ischemia, there is osteonecrosis, and ultimately the sequelae joint dysfunction. So apart from that, there can be congenital clotting defect. The anticardiolipin antibody is found higher. Antiphospholipid antibody is also found higher in some of the cases. These children do have pain in the groin, refer to the anterolateral thigh, and there is antalgic gaits. The gait is gait phase of the affected side is a little bit delayed, and there is lateral rotation and abduction limitations. Mild hip flexion and your deformities are common. Tissue atrophy of the buttocks, thighs, and cuff is quite frequent, and there is apparent leg length inequity. One is smaller than the other. It's very a little bit of disturbing sort of symptom, and then finally there occurs true leg shortening. So diagnose this case is early by dint of an X-ray, pelvic AP view, and frog leg position. You call it Lornstein position. So what do you see in the X-ray? The less ossification centers, they are diminished, and the lateral femoral head is little bit of trouble, and joint species is increased. There is a fascial irregularities and fragmentation of the epiphysis in worst possible cases. Open bones are seen, and at times you have subchondral fracture. MRI see the details of this clinical X-ray findings, as I said earlier. So you can do one MRI. Treatment is Petri cast, and to raise the your joint, and for 6 weeks or so, followed by your abduction orthoscopy, and refer to a good your orthopedic surgeon. And at times when it fails, you need to go for the osteotomy, but do it earlier, before 6 months. 6 years prognosis is good, recovery with very few symptoms. After 9 years you usually have the poor prognosis.